Hello and welcome. I'm Jansson from Acupuncture Brisbane. I practice a very gentle form of traditional acupuncture in Woolloongabba at the famous Gabba cricket ground. I've been in this location at the Queensland Sports Medicine Centre for the past 14 years. In that time, I've gone through several phases, not mutually exclusive, actually inclusive. Initially, I worked predominantly with elite sports people from this practice. In the Helicon years of the Brisbane Lions, from actually 1998 right through to 2004, I was integrally involved in the sports medicine side of working with the Brisbane Lions football team. It was an extremely exciting time, and I would like to think I played a role in seeing the Brisbane Lions bring home 3 premierships in that period. I still work with elite sports people. One of the offshoots of working with the Brisbane Lions in that time, I did a lot of work with the full forward, a wonderful gentleman and an incredible athlete, Alistair Lynch, who had an incredibly well publicised case of chronic fatigue syndrome. My working with Alistair opened up a number of doors of other elite athletes that were suffering from chronic fatigue syndrome, including a number of swimmers. Daniel Kowalski had a variety of chronic fatigue syndrome. Emma Snowsill, our triathlete, our gold medal triathlete, she also benefited hugely from treatment for chronic fatigue syndrome. So I evolved, if you like, from working with sports injuries and associated fatigue problems, so they're kind of more or less integrated into a practice of working with elite sports people, chronic fatigue. Then, unusually in a sports medicine centre, I became more focused on working with in a prenatal way with expectant mothers. This comes as a result of me being a general practitioner who specialises in different areas of medical practice, in the sense of alternative medical practice. I've done an extraordinary amount of work, and for a number of years I was seeing many women, helping them to prepare for a less arduous childbirth, working with morning sickness, with gestational diabetes, problems with mastitis and breastfeeding. These areas again integrated. So we moved from sports into chronic fatigue, then prenatal, and also I've done an enormous amount of work with children, all from a sports medicine centre. Quite ironic. And it's very interesting to walk out into the waiting room to call in one of my patients and seeing lots of young people and sports people, and then 2 or 3 pregnant women waiting to come in. But it is a very special feeling, and it's a privilege also to work with such a variety of people and helping them to overcome some deleterious health conditions. As a result of working with the prenatal scenario, I also done quite a bit of work in helping couples to fall pregnant, or helping the woman to fall pregnant, but obviously working in many instances, sometimes in conjunction with the IVF programs that are available. This is incredibly rewarding work, and I like to say that I really enjoy this work, and the success rate is very encouraging in this form of treatment. The next phase that I evolved into, and again I emphasise that I'm taking each of these phases with me, I'm not leaving anything behind. I have the privilege of being associated with Dr. Andy Rosenfarb, a very famous acupuncturist from the United States who works with people all over the world with degenerative eye disease. As a result of this association I now do a lot of work with people suffering from various degenerative eye conditions, retinitis pigmentosa, wet and dry macular degeneration, dry eye, Stargardt's, a plethora of different degenerative eye conditions. And again, it's adding another arrow to my quiver, if you like. Excuse the pun. But this is a product of being in practice for 30 years as I move from phase to phase and integrate and evolve as a practitioner. And it's the beauty is that I'm able to take each of these phases with me. I've also done and still do a lot of work, especially with young people who are suffering from glandular fever. It's such a debilitating situation, and I find many people, especially those in junior high school and senior high school, it's such a debilitating condition for them. And there's so much pressure with their exams and with performance criteria, and to have them carrying a debilitating condition like glandular fever and trying to perform satisfactorily in the current education scenario, it's a very sad situation, and I'm very pleased to say that in many cases we are able to give them great support and help them through the process so that they can overcome this disease condition, glandular fever, in some cases Ross River fever and Barmah Forest fever. This leads me into an all-encompassing scenario of the 21st century: stress, anxiety, insomnia. People don't talk about this. This is not something that everyone's running around saying, I'm suffering from stress, I suffer from insomnia. But I know as a clinician of 30 years of experience that we are now peaking, and many of my patients who come in for sore knees, sore backs, headaches, stiff necks, sore elbows, sore shoulders, bad fingers, digestive problems, underlying this in many cases, and almost 50% of cases, is insomnia. And insomnia and the anxiety fulcrum are there, and they're prevalent, and they're growing in this age of the internet. Supposedly the internet was going to give us more recreational time, more time to relax and enjoy ourselves. Ironically, and from a clinical perspective, I've found this is just not the case. Anyway, this was just a summation of where I've come from, where I am at now here at the Queensland Sports Medicine Centre at the Woolloongabba Cricket Ground. I've been practicing acupuncture in Brisbane now for 16 years, the last 14 of which have been here at the Woolloongabba Cricket Ground. This is Alan from Acupuncture Brisbane saying thank you very much for taking the time.